After smoking for 30 years and turning 50, I went to my primary care physician and got a complete physical and all the labs and testing that needed to be done. And she suggested that I do a colonoscopy because I was at the age and had quit smoking. So I went for the colonoscopy. All my tests came back great except for that one. There was some polyps, but there was also a lesion. And when I woke up from the colonoscopy, that gastroenterologist suggested me to go see Dr. Caliendo.
After a biopsy was performed, the biopsy unfortunately returned as adenocarcinoma, which is the cancer that we see in the rectum. In my patient's particular case, fortunately she had no evidence of any spread on the CAT scans. However, her MRI did show that it was into the wall of the rectum or almost completely through the wall. So that would make it a T2 or T3, which would indicate that she would need prior treatment before surgery. The treatment prior to surgery is chemotherapy and radiation. What that does is it shrinks the tumor and long-term will decrease the chance of the cancer recurring.
My life was I didn't lose my hair, I didn't vomit, it wasn't sort of all the things we think about chemotherapy and radiation. It was pretty manageable.
At the conclusion of that treatment, the tumor was still present but extremely small, so the treatment had significantly shrunk the tumor. And the issue with Miranda's case is that it was extremely low.
In May of 2022, I had my surgery to remove any cancer that the chemotherapy and radiation did not take care of.
And here we use the Da Vinci robot system exclusively, and this allows us to get below low pelvic rectal tumors and get a negative margin, meaning getting enough tissue around the tumor where there's a decreased chance of it recurring.
Dr. Caliendo is a caring, compassionate doctor. He doesn't belabor any points. My stay in the hospital with his team and the nurses and everything, I never felt like, and the rest of the surgeons in his practice, I never felt like somebody didn't know who I was or somebody didn't know what I was going through at whatever stage I was at. And any issues that I did have were like quickly, I would call the office. If I didn't speak to Dr. Caliendo, I spoke to Grace, his PA, and I was able to get anything I needed.
Miranda's prognosis is extremely good. At the conclusion of her surgery, there was basically took it from a stage 2 with a T3 down to a stage 1. So she has a 5-year survival of mid to high 90s. Any change in bowel habits, if a patient is completely regular according to them and things start to change, that's an indication for a colonoscopy. Any signs of bleeding, weight loss, overall abdominal discomfort, malaise, those are symptoms that should be evaluated by colonoscopy at any age. A first-degree relative, mother or father with colon cancer, we screen those patients 10 years before the relative had the colon cancer. So if unfortunately mom or dad had a colon cancer at age 45, you should have a colonoscopy at 35. Without symptoms, we now are screening patients at 45 years of age. We brought it down from 50. We've been seeing, unfortunately, colon cancer in young patients. The youngest patient I've treated with a colon cancer is 28.
Colorectal cancer screening is vital and the most important thing that you can do for yourself. I was scared to do it. I'm glad I did it. If I had waited, my prognosis would have been completely different. Most of the time you're going to go and it's going to be fine. And early detection changes the outcome tremendously.